Well, there are more than 3,000 confirmed cases of the coronavirus across the African continent, with a number of African countries imposing a range of preventative and containment measures against the spread of the pandemic. For more on this, I'm now joined on the line by SABC News' foreign editor, Sophie Mokoena. Good evening and welcome to The Full View. I guess it goes without saying that all countries are now coming together to try and find a solution on how you need to make sure that you contain the spread of this virus, especially considering that China has been able to flatten that curve.
Yes, indeed, particularly on the continent. You are aware that South Africa is the chair of the African Union. The president, the chair of the African Union, convened a meeting with other heads of state, a conference, a teleconference and a video conference, talking about this issue. Among those who participated in that teleconference, it was the president of Mali, Keita, and also president of Kenya, Uhuru Kenyatta, the president of Egypt, the former chair of the AU, Al-Sisi, and of course the president of the Republic of South Africa, the current chair, where they exchanged views in terms of what needs to be done. They finally came with a conclusion to set up centers in all the regions on the continent, the North Africa region, the West Africa region, East Africa, and South, where they are going to ensure that you have these regional centers. These regional centers, all ministers of health in those respective regions will share information, exchange information, have a teleconference to discuss the implication and the challenges in that particular region, and also come up with solutions. Then take that information, send it to CDC in Addis Ababa, where Addis Ababa will then disseminate information, cross-information from other regions, so that other regions can learn from those regions who are making progress. The second issue that they did was to establish a fund. You'd recall that in 2014, Patrice Motsepe and Alika Dangote established what they call the Ebola Fund. This time around, they have established what is called the Corona Fund, and they were able to raise $17 million. And therefore, they are hoping that many other countries will pledge, and this fund can be given to the CDC, and CDC can kind of share this resource and ensure that particularly the vulnerable countries do get help.
I think quite important to that communique that was also sent after that particular teleconference took place is the sentiment that came out from the Bureau as well, is that countries that owe money to international financiers, like for instance the IMF as well as the World Bank, they should be allowed some legroom around the interest that they have to pay on those loans being suspended.
Yes, that's what the president said as the chair of the AU, talking to the G20 member countries. You know that South Africa is the only African country that is part of the G20, but he was joined by the Rwandan president, Paul Kagame. It was a teleconference, and they were a video conference where they were sharing views with other heads of state from the G20 group. And you know that Donald Trump also touched on what President Ramaphosa said. The president emphasizing that you have to come up with something that would assist the poorer countries. And this is what the president conveyed to all those G20 member countries, that IMF and World Bank, they must relook at their relationship with those countries. We know that many of those countries are owing such institutions a lot of money, and their interest will also add up to the challenges in terms of resources for those countries. And that's what the president requested. But not only the president, even the Secretary General of the United Nations, Antonio Guterres, when he was speaking to the SABC from New York last week, he indicated that this has to be done. We have to relook at relationships, but also to ensure that the financial institutions around the world are part of the solution, not the problem. Even here in South Africa, we saw the announcement by the Minister of Finance today in terms of the interventions that must be done by financial institutions, by government in terms of SARS. And I think everybody's saying all hands on deck.
Yeah, certainly. And also, this particular message comes just on a particular day when South Africa says that it is looking at going to the likes of the World Bank as well as the IMF to assist. But just quickly on the statement from the G20 as well, where the member states have agreed to put together $5 trillion. Why is this money so important, and do we have any ideas yet how it will be used?
It's quite important. This money will assist in unlocking resources, particularly for poorer countries, because this money will be given to the World Health Organization. The World Health Organization member countries are almost all over the world, particularly the poorer countries are part of the World Health Organization. The World Health Organization will be able to identify needs, particularly on issues such as protective gear, issues such as masks, issues such as gloves, to ensure that the health officials, those who are in the front line, are protected. Because the problem we have now is resources. Some countries can't afford, can't stockpile. And because a continent like Africa, we are coming in at a very crucial time where many countries are scrambling to get whatever resources and whatever needs they can get to address this crisis, and they have bank balances. We are now scrambling, and I think World Health Organization will be able to say, these are the vulnerable countries, let's help them, let's buy these, the needed stuff to assist in stopping this thing, or perhaps trying to manage the spread of the coronavirus. And I think that money will go a long way in helping particularly the poor countries in sub-Sahara.
And looking at the coverage of the coronavirus, the focus has mainly been around the telling of the numbers. So we always look at the infect numbers, the toll around the infect numbers, the death toll as well. And now we're speaking about the financial impact and the financial implications and the resources that are needed. But one conversation that has been absent from this whole discourse is issues around conflict and countries that are in conflict. We've seen that the United Nations General Secretary, Antonio Guterres, has called for a ceasefire, a global ceasefire. Now we've seen a similar call now from Pope Francis.
The term used for such countries, they are called failed states or vulnerable states. Unfortunately, right now, we have forgotten about such states. I mean, when you look at South Sudan, when you look at the north of the DRC, where you still have these pockets of conflict, when you look at CAR and many other countries in other parts of the world, we have forgotten that when there is conflict, the World Health Organization, the World Food Program cannot assist the vulnerable people in those countries. That is why the Secretary General last week made an appeal of ceasefire worldwide, so that the whole world can focus on addressing the issue of the coronavirus. And these calls are being made by religious leaders, by NGOs, by many other people who are saying, ceasefire, ceasefire, let's deal with the real war that we have, that is the coronavirus.
Certainly. Thank you so much, Sopho Mokoena, the editor, the Foreign Desk editor there, joining us on the line. Indeed, currently as it stands, you have, for instance, in Libya, which we know which has been going through a conflict, 2 cases that have been confirmed of the coronavirus, but some are saying that the reason that you only have these 2 cases is because there's no full capacity to make sure that you have these tests take place in a war-torn country like Libya.